Welcome, I'm Enrico Maraskin. I'm a pediatrician practicing in Morningside in South Africa. This is my passion, little children. I love seeing children in their natural setting, learning, discovering, going to school, playing sport and staying happy. Here we have the vaccine schedule that is produced by the Pediatric Management Group of South Africa, and we can see from the schedule, very busy slide, and by the time the child gets to 12 years of age, we see that there are lots of injections and lots of holes in this poor child's skin. However, on the left-hand column, we have a long list of illnesses which we're going to consider today. Pneumococcal disease, this is a bug that also causes meningitis, septicemia, pneumonia, but in addition also causes otitis media. And this disease causes a huge burden of disease to our population. Pneumococcal pneumonia caused 1.2 million deaths in children less than 5 years of age worldwide prior to vaccinations. The illness can be as simple as an ear infection or as devastating as septicemia or meningitis. The vaccination has decreased severe disease by between 80 and 100%, and ear infections by 50 to 60%. So in my younger years, prior to the introduction of this vaccine, I used to run up and down to the hospital, having to perform many procedures on children, including lumbar punctures and bloods for blood culture and trips, and administering intravenous antibiotics, and also CT scans for investigations, and children with the worst manifestation of this illness, meningitis, often also suffering from brain damage. In our pictures, on the left we have a picture which actually looks quite nice for a horrible disease that causes a lot of damage, and on the right we have a child who's suffering from pneumonia, requiring admission to hospital and intravenous antibiotics.
So, having considered the facts pro and con vaccination, what is your decision? I came across this site on the internet. I consent to being forcibly restrained and injected with multiple viral strains, preservatives and heavy metal adjuvants. Said no baby ever. Having looked at all the facts in our talk, you can see that the effects or side effects of the vaccine are very small if one compares it to the devastating effects of the illnesses that we deal with. If we have a look at the right-hand slide, we have a child who's fully immunized and protected against these life-changing illnesses. In my opinion, if I had to choose, I would choose to vaccinate my children fully, with the knowledge that we are placing these children at risk if we don't vaccinate.
So thank you for joining me, Enrico Maraskin, in this discussion. I hope I've shown you the reason for my passion for controlling the disease processes that we vaccinate against, and I hope it'll give you some insight into making your own decision of whether to vaccinate or not vaccinate.